you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gami because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hi everyone, and welcome to a fresh episode of Ask the Pediatricians Hour. I am Bimisola Boyde. I'm a pediatrician, and I'm your anchor for today. And this program is a continuation of our last broadcast where we discussed first aid care in children. We talk about things we can do at home when children have, symptoms, and before we take them to the hospital. So I'm going to conclude that episode today, looking at other conditions that children may have at home and what we can do as parents before we eventually get to the hospital. So welcome to today's podcast. This program is brought to you by Ask the Pediatricians Foundation. As Ask the Pediatricians Foundation, we're fully committed to the health and welfare of all children globally, especially in sub-Saharan Africa, Nigeria, where majority of our children die before their fifth birthday from things that are largely preventable and treatable. Our role, our mission is to ensure that no child dies from such preventable illnesses or conditions. And we do that through our health education and information platforms on social media, on radios like Fresh Waves Radio, and even on our website. And beyond that, we actually also do physical community medical outreaches in indigent communities with limited access to healthcare professionals. So this program, Ask Pediatrician Hour, which is brought to you every Thursday by 10 a.m. on our YouTube channel, our Facebook page, and Facebook groups, Fresh Waves Radio, and the Facebook page as well as my podcast platform, Hacks Dr. Bimi ATP, is one of our channels from doing this health education and information. And you know that you can watch or listen to past episodes of all the topics we've discussed from any of these platforms that you're watching on right now. So if you want to listen, you can head over to Ask Dr. Bimi ATP podcast. It's available on Spotify, Google Podcasts, Amazon Music, and many of the podcast platforms. Or you can actually watch it on Hacks the Pediatrician Foundation YouTube channel, ATP TV. And of course, the videos are always available on our Facebook pages. So feel free to learn from any of these platforms. And if you have questions, you can always post your questions on Ask the Pediatricians Facebook group. Our Facebook group is open from Mondays to Saturdays, 24 hours daily. So feel free to post your questions, and a pediatrician or a professional will be available to give you an answer with support from our medical, non-medical moderators. So, and you can be sure that whatever answer that you get on our platform is an evidence-based from a professional point of view. So thank you so much. We want to welcome you for and thank you so much for joining me today. And so I'm going to continue from where I stopped. If you have not listened to the part one of this first aid care, I want to encourage you to do so. Last episode, I talked about first aid care for fever, and I also talked about first aid care for diarrhea, and I also talk about first aid care for cough in children. And I think those were the three that we're able to take on that episode. And so, what do you do if your child is having fever? What do you do if your child is having watery stool, or if your child is coughing? What do you do before you hand over to the hospital? Please, I will encourage you to listen to that so that this episode will also make sense. So let's continue. We're going to go to the fourth one, and we're going to talk about convulsion, which is something that tends to happen, and this can be very scary for parents, especially new parents. Most children tend to have fever. That's why it's important for you to listen to the last week episode of fever. And we talked about how to reduce the fever, because one of the reasons we have to reduce fever in children is because of convulsion. Because when fever is high, the child can actually begin to convulse, where they start checking or stretched out like that. That's what we call convulsion, and it can be quite a scary thing for parents. And actually, some children can also have convulsion without fever, what we call afebrile seizures. So, and most time when children are having convulsions or seizures, people don't really know what to do, especially in Nigeria, and you see people getting water, pouring water on the child, and some getting like all this pastel or tonic stick or spoon and forcing it into the mouth of the child, because they have this fear that the child must not clench the teeth or he must not bite the tongue, that if the child does that, the child is going to die. Anyway, that is a myth. That is not true. However, I can imagine that it can be quite scary witnessing a child having convulsion or seizure. So we need to know what to do when a child is having convulsion. And the most common of this is due to fever. Most children between the age of 6 months and 6 years may have convulsion when they have fever, and it tends to run in their family, and some children have it more often than other children. Some children, anytime they have fever, they're going to have convulsion, whereas some children, it's not all the time. And like I said, it can be very frightening and all that. And sometimes the interventions, so-called, that people do in the process can actually cause more problem for the child than the conversion itself. So it is important for us as parents to know, what do I do if my child is convulsing? So in as much as I'm going to tell us what to do, I'm also going to tell us what not to do, because in my experience as a pediatrician, sometimes we tend to deal more with the consequences of people doing the wrong thing. Okay, I always tell the stories of a child that has febrile convulsion due to malaria, and of course, people start putting the child's hands and legs in fire as their own first aid kind of treatment, and of course the child got burns, and we actually spend more days and thousands of naira trying to treat the burns that were caused by people who are trying to help the child having conversion. The malaria itself that caused the conversion, we've treated it in 3 days, and the child would have gone home if nothing else has been done. But because people were trying to resuscitate in quotes and they burned the hands and legs, we actually spend more days, weeks, and months trying to deal with that. This is completely something that should not have happened. So please do not do some of those things, which I will see emphasize. The truth of the matter is that if a child is having convulsion at home, there's really nothing you can do about the conversion. That is the honest truth, really. That is the honest truth. There's nothing you can do to stop the conversion, because most of the drugs, except for children that tend to have conversion often, not necessarily due to fever, because they tend to have what we call epilepsy, sometimes we give the parents drugs that they can use for when they're having seizures. So we have some kind of drugs. Some of them, they just put it in the cheek, and the child can absorb it, or some we can put it through the anus. So we do give some of those parents those kind of emergency drugs, but majority of parents whose children don't tend to have convulsions or seizures often, we don't give them those drugs. So the first time the children are going to have convulsion, there's really nothing you can do. You cannot stop that convulsion by yourself. So putting spirits, putting honey, palm kernel, burning the hands, and all those things, they are doing nothing, and they're actually going to cause more harm to the children. So please, there's nothing you can do to stop the conversion that is happening at home. The best thing that can happen is for that child to be taken to the hospital, because most of the drugs that we use to stop conversions, they are injections, they are things that have to be given at the hospital. But there are a few things you can still do, because the most important thing is not the conversion itself, is the danger, is the accident, the injury that a child can sustain during the process of having the conversion. So what do we do? Just stay calm. All right, stay calm. I know it's not easy for parents, especially, but if you're witnessing a child having conversion, that's not to start panicking, everybody running to schedule and all that. No, just stay calm. If you can take note of the time when the conversion is starting, take note of it, because we want you to help us know how long that conversion is going to last. The most important thing is to make sure that this child does not hurt himself or herself while having conversion. So you want to put the child in a space that is flat surface, that is soft, so you don't want the child to fall and hit their head on concrete or hard surface floor. You want to remove any tight clothes, chains, or tight fitted clothes, things that can hurt the child, So those are the things you want to take away, and then you wait for the conversion to stop. That is the truth. There's really nothing you can do. The most important thing is that you don't allow the child to hurt themselves in the process. So you can put them on the side, so that the tongue and the saliva, everything can be falling out and not go backwards. So that's all you need to do, and wait for the conversion to stop. All right, so don't try to do anything heroic. Don't pour water. I know we do that a lot in Nigeria, and I keep asking myself where that originated from. Going through medical school, going through all my training, there was never any parts where you are taught about water resuscitation. But I see people, anytime somebody is fainting or convulsing, the next thing people are opening water and pouring water on them. Please, let's stop it. It's wrong. And we actually I know we meant well, but we do more harm in that process. So for conversion, the most important thing is to ensure that the child does not hurt him or herself while having the episode of this checking and all that. Make sure the child is safe. There's nothing tight around them. There's nothing like sharp edges, sharp surfaces that they can hurt themselves on. And just wait for the conversion to stop. And once the conversion stops, you take them to the hospital. Okay, that's all you need to do. Okay, that's all you need to do. What you should not do, which I find it as important to tell us about what we should not do, because people do a lot of things that are wrong. And like I said, sometimes the consequence or the repercussion of that is even worse than the conversion itself that the child is having. So what you should not do, please do not try and hold and restrain the child. Trying to hold the child and trying to stop them from converting is not going to stop the conversion. You cannot stop a conversion by holding the child. It's a discharge going on in the brain. It's an abnormal discharge from the brain that is making the hands and the legs to drag. So holding them, and if you can hold somebody and stop a conversion, that is not a conversion. We call it pseudo seizure, because some people fake. It's really adolescent girls or some people who don't want to do something, or they want to be dramatic for one reason or the other. For whatever reason, some people can actually fake seizures. So if you hold them and it stops, most likely they are not actually having a true seizure. Or if they can really look at you and they are, most time when children are having this kind of conversion, is generalized. It's affecting both legs, both hands, and they are not aware. They are not conscious of what is going on around them. So you cannot stop a conversion by holding the child tight, okay? And please do not put anything in their mouth, okay? Whether they clench their teeth, bite their tongue, it's not going to cause them any harm. They're not going to die from clenching their teeth. So a lot of people try to put all these tonic stick, spoons, wood, whatever in the mouth. In the process, they actually damage the teeth of the child. They actually cause injuries to the lips and all that. So at the end of the day, the dentists have a lot of work to do after the session. So from what we call iatrogenic causes, things that are caused by people trying to help. So don't put anything in the mouth of the child, all right? Don't force. At that point, you should never try to force them to drink anything or drink, whether it's anointing oil or anything. They should never drink anything. They should never eat anything in a child who is convulsing, because they are not conscious and they can aspirate, things can go the wrong way if you try to put anything in their mouth. So please do not put anything in their mouth, including your fingers. You can bite your fingers and cut it off. Remember, they are not conscious of what is happening. So no knife, no spoon, no stick, nothing in the mouth of the child. No need for onions, salt, pepper, methylated spirit, olive oil, all these things that people put on their eyes. People say there's smelling salt, there's whatever. No, please do not put any of these things on the eyes, on the nose, or the mouth of the child. Do not do that. So, okay, do not put the hands and feet in fire. I've just told you a story. Can say just remember that child, lying down in the children's ward at Lagos University General Hospital, from burns injury. Then we have to deal with infection. We have to transfer the child. It's a mom that is struggling. There's no money. All these things that now took us several months to deal with, we should never have been dealing with. We should have sent that child home on the third day after treating the malaria that the child had. But we spent months treating the complication of people trying to resuscitate the child by burning the child's hands and legs. Sometimes when you burn hands, it's a major thing. The children develop contractions. They now need to go for surgery, plastic surgery, to release those contractions. So please, in medicine, there's one of our principles: if you're not going to do any good, please do no harm. First and foremost, you must never do harm. So if you don't know what to do, do nothing. It's far better than doing the wrong thing and causing more harm to the child. So first, do no harm. So if you don't know what to do, just let the child alone. Like I said, for conversion, that's principles hold so true. You can't really stop a conversion. You have to just wait for it to stop. But please don't do things that will cause harm, worse harm to the child. All right. So do not try to give them a bath. Most times children who are having conversion, they have fever. That's not the time to do your tepid sponging or pour cold water on them. Please don't. Just leave them alone. And after the conversion, they must always go to the hospital. I know sometimes parents feel this conversion is over. Yeah, it is over, but we need to know why the child convulsed. We need to know how to avoid the conversion from happening again. So we need to take the child to the hospital so that the doctors can investigate the child, and then they can now tell you, okay, this is why this child is having the conversion. So you must always take the child to the hospital. And when the child goes to the hospital, it's now the job of the doctors to treat the underlying cause of that conversion itself. All right. So that's the job of the doctor, to treat the conversion. So please do that, and they can treat. So if it's a febrile conversion, most time we just treat the cause of the fever, and that is all. But if it's a child who is having what we call afebrile seizures or epilepsy, sometimes we have to put the children on medication so that they don't keep on having, especially if this is not the first time, this is not the second time, we don't want them to keep having recurrent seizures. So yeah, we can do that in such cases. And it's very important, especially if seizure is going on for more than 5 minutes, you need to get call emergency services. Sometimes most children will have conversion into last but like 30 seconds, maximum 1 minute, and that is it. And once that happens, then you can take the child to the hospital, and that may be the only conversion the child is going to have. But some children will not wake up after the first conversion, and then they will keep on having more conversion and more conversion. And so for such children, you now need to take them to the hospital. So for such children, you really need to take them to call emergency services if the fever, the conversion is going on for more than 5 minutes, because they are developing what we call status epilepticus. Status epilepticus is the kind of conversion that go on for 30 minutes, or the child doesn't fully recover from one episode before another one comes on. So that is how to handle conversions. So that's that. Now let's go on to the next one. I'm going to go on to another thing that tends to happen at home. And this time around, I'm going to talk about poisonings. And this happens a lot. And we must know what to do. In fact, one of the questions will happen a lot, that we tend to deal with a lot on ATP, is parents telling us, my child took this drug that's not meant to take. Acute accidental poisoning is quite common, especially in children between the age of 0 and 5. They are the one that tends to have. And because when you look at the picture I'm showing on the screen, you can see that the these are all like household cleaning stuff that you've put under your sink. And but for a child, they like the colors, they like all those lovely, they may think it's maybe juice or something, and children are very curious, and then they want to try and touch it or drink it and all that. So always talk to parents a lot about the need for us to child-proof our home and to prevent accidental poisoning is very, very important. In Nigeria, especially, the most commonly ingested poison, the thing that most children tends to take in wrongly is kerosene, because most family use kerosene for their for cooking and all that. And unfortunately, this economic situation, most people buy it in small quantities, and most of the people that sell this kerosene in small quantities tend to put it in the normal bottles, the old bottles of drinks like water or Coke or Fanta or ever, So most time, and kerosene is colorless. So when these children see those bottles, they think it's actually the original content that is there. I'm not sure. I don't think there's the smell, the ability to perceive smell is that strong. So some of them just drink it thinking it's water, or thinking it's drinks like Sprite or Pepsi or Coke or whatever. And until thank God the taste is so bad, immediately start drinking, they know immediately that this is wrong, and they stop. But it's one of the most common case that we tend to see when it comes to accidental poisoning. But children also take things parents tend to call vitamin C sweets, and children think drugs are sweets, and so children tend to hit them. And some parents always give children vitamin C like sweet. Please don't do that. You must never tell your children that drugs are sweets. Even vitamin C, they are not sweet, they are drugs, and they can be overdosed on. And some of us, especially pregnant mothers, we can be very careless with all these your iron supplements, and children will now take them, and children can have iron poisoning, overdose of iron. So all these drugs, some people take the drug, just leave it. At their age, from 0 to 5, they are very curious, they are exploring, and it doesn't take them anything. There's a case recently, a mother telling us she wanted to give her child Flagyl for diarrhea, and she ended up giving that child her own antihypertensive drugs, because some of these drugs, they look alike. So please, as parents, the most important thing when it comes to accidental poisoning is prevention. Okay, I know I'm here to tell you about the first aid, but I would rather you work on making sure that it doesn't even happen at all. That's the goal. We want to make sure it doesn't happen at all. So accidental poisoning, a poison is anything that when taken or absorbed into the body, you don't have to take it by mouth, even it can just be on the skin and all that. It can cause damage to the organs of the body. And virtually everything in our house can be a poison. Okay, so poison can be swallowed either as food or drugs or kerosene, like I mentioned. It can be absorbed from the skin, especially for children. Their skin very it's still, compared to their body size, their skin is quite large. So anything exposed to the child's skin can get absorbed into the body. It can be inhaled. All this cigarette smoke is poison when children inhale them. That's why we don't want you to smoke in the house with children. Of course, going into the eyes, most of us know that already. Or it can be injected, usually for drug addicts, for example, that injects all this heroin and stuff into the body. The children can sometimes go through the same thing as well. So don't worry about this slide, just giving examples of all the possible form of poisons that are possible. But like I said, the most common in Africa, in Nigeria, is kerosene poisoning. Okay, and the reason is because which is something I think the government needs to legislate against. We shouldn't be storing kerosene, petrol. We shouldn't be storing them in cans or bottles of drinks. Children will not know. They will think Coke should contain Coke, or ever should contain water. So please, if you are the type that use kerosene to cook at home, please, you really need to make sure that, number one, you don't store your kerosene in bottles of drinks. Then where you keep them, it has to be locked away. So there are some things children should not have access into the kitchen. All toddlers should never go into the kitchen. And then you need to lock things away so that way your children will not accidentally get poisoned, because children are curious and they're going to figure it out. All right, so let's use kerosene poison as an example of a poison. And what do you do if it has happened? Of course, when it has happened, it has happened. And kerosene can cause damage to virtually all the organs. So it can affect the stomach. The children can be vomiting. They can have diarrhea. They can have ulcer. It can cause pneumonia, what we call lipoid pneumonia. It can affect the heart, cause irregular heartbeats. It can affect the brain. The children have what we call encephalopathy. In other words, they become unconscious and comatose and all that. And so these are all things that can happen. Sometimes, if this quantity is so small, nothing may happen. So the child, we just know the child is taking the kerosene. Just as luckily, most children, immediately they start drinking it, they realize quickly that they're doing the wrong thing and they stop. So most times children don't take in enough quantity to cause all those serious damages, but it can still happen. So there's no specific drugs or treatment for when it has happened. What we do is what we call symptomatic treatment. We cannot. Then another thing people do is that when children inhaled or ingested poison, then people try to make them to vomit, and the commonest thing people do is to give them palm oil. I've written an article on what I call the palm oil antidotes. It's very common in Africa. We even have proverbs like palm oil is the antidote for everything. Like if something happen, just give them palm oil. In Yoruba, they call palm oil error. In other words, it's like an antidote. All right, well, it's not true. Okay, you should not be giving palm oil to children. You do not induce vomiting in children with palm oil, because palm oil itself can be inhaled, because it's what we call hydrocarbon. It's something that is volatile. So when you give children palm oil and trying to make them to vomit, in the process of vomiting, of course, they're going to vomit the palm oil as well. Part of that palm oil is going to be inhaled into the lungs of the children. And when it gets into the lungs, it's caused a form of pneumonia we call lipoid pneumonia, which can be very dangerous. Most of such children are going to end up in the ICU because they will need respiratory support. So please do not, especially for children who have taken kerosene, please don't give them anything. Don't give them palm oil, especially to drink. Don't force them to vomit, okay? Don't. So if your child has taken kerosene, what you need to do is to take them to the hospital. So it depends on how long ago it happens. So we expect that if a child has taken a quantity that is going to cause symptoms, that should happen within the first 6 hours. So within 6 hours, we spend some time, we do x-ray to check whether there are changes in the lungs, suggesting pneumonia and all that. So, but if after 6 hours, there's no symptoms, respiratory symptoms, and the child is otherwise well, we will just leave them and observe them. But if the child is showing signs of respiratory distress or other signs of other illness, then we admit the child to the hospital, we observe them, we do what we call symptomatic treatment. Like I said, we don't have specific drugs to treat some of these poisons, like kerosene poison. There are some poisoning that's like paracetamol, for example, or iron, if the children take too much of them. So what we normally do, if the children come to the hospital, if your child takes poison, the child has to go to the hospital within 1 hour. We want that child to be in the hospital within the first hour. And the reason why you want that is that you want to quickly see how much of that poison you can get out of that child. So if some people will post on ATP, and obviously most of us are working in the hospital, we only tend to answer your question in the evening and all that. So please, when your child is taking a poison, it's an emergency. It is not I'm posting on Facebook, I'm waiting. No, it's I'm going to the hospital now. Immediately you discover you're going to the hospital. Because if you get to the hospital on time, there are things we can do. We can use what we call activated charcoal. We can give it into the child, or we can do gastric lavage. We can give activated charcoal and try to absorb the poison from the system of the child before it starts getting to the bloodstream and all that. And there are also poisons that there are actually what we call poison centers, which in some countries you can actually call them and tell them my child has taken poison. I don't really think we have a poison center in Nigeria, but some countries have poison centers, and some of these poison centers have websites, so you can actually go to the website or you can call them and they will tell you what to do. But if you're not sure what to do, or you don't have a poison center in your locale, then you have to take your child to the hospital. And usually when you come to us at the hospital emergency room, we can we can still make some maneuvers to try and see whether we can get the poison out before it gets absorbed. So, but then you have to present within 1 hour. After 1 hour, we're really racing against time, because by that most of the poison will be getting into the bloodstream. And then there are drugs we can give, like for iron poisoning, we can chelate the iron. There are drugs we can give and it will kind of absorb the iron out of the blood. For the same thing for paracetamol overdose, people don't know that children can overdose on paracetamol, even as simple as it is, as it's over the cancer drugs. Your child can take too much of paracetamol, they're going to end up with liver failure. So you don't want to leave paracetamol hanging around children anyhow. There are drugs we can give for that as well. And for things like morphine, for those who those who abuse opioid drugs, there are lanozone that we can give to kind of reverse the effect. So we have, for some drugs, if they are overdosed on, things that we can do to absorb it or reverse the effect. And there are some, majority of them we just try the activated charcoal to kind of absorb it, but if you come within the first hour. For some, we can't do anything. We just do what we call symptomatic treatment. In other words, you support. If the child is having difficulty with breathing, you give respiratory support. If the child is vomiting, you rehydrate them. You just treat what you can treat and hope and pray for the best. So, but coming back again, for accidental poisoning, the most important thing is let it not happen at all. We don't want to be treating it when it has happened. And I really want to plead with our parents. Yesterday on ATP alone, I was answering like questions about children eating hair pod, and about children, another child giving a baby dirty water to drink and all that. And what that tells us is lack of supervision. It's negligence, because these babies must never be left alone. We should never be living. And the question I always want to ask is, where were you, mom? Where were you? I mean, I know sometimes parents don't like that. It's not like trying to blame you, but you should always have been there. And if you are not going to be there, somebody else with adults responsible should be there. We should never leave children unsupervised. We should never leave babies with other children, like leaving your 6-month-old baby with a 5-year-old or a 4-year-old. It's still a baby. It can't take care of the baby for you. So if you're not going to be there, you carry your baby with you, okay? Or you put them in a place where you know nothing will happen until you come back, So we really need to make sure that we always supervise our toddlers, our infants. We must never leave them alone, because these things happen in splits of seconds, and the consequence can be lifelong and it can be fatal. So we should not even allow it to happen at all. It's not everything that we can fix. Sometimes it's too late to fix some things. So please, let's be more let's try and supervise our children, especially that those 0 to 5 years old. They need constant supervision. All right. So let's talk about the 4 A's of accidental poisoning, because primary prevention, let it not even happen at all, is the best in this scenario. This is not like it has happened, what do I do? This is like, don't let it even happen. Okay. So what you can do, number one, be aware, which is what I'm doing right now. I'm creating awareness. We have a month every year we create awareness about accidental poisoning. We need people to know. A lot of us as parents, sometimes we don't think about it. We don't know it can happen. And then when it happens, we're like surprised. So, but if you're always aware that this can happen, then you're always looking at your house from that perspective. So when you're using your drugs, you don't just drop it or leave it in a cupboard that is not locked. Your fridge has to be locked. You don't just allow your children less than 5 in your kitchen. You have to be constantly aware of these things, and you've always got to get your children in your eyesight at all times. That is very important. All right. Then we've increased awareness, we decrease attractiveness. Don't let's make all these things attractive to children. Children are always attracted by all those things. So don't leave your iron tablets lying around. Don't leave your vitamin C lying around. Some of us just leave them on our dining tables or all over the place and like, oh, I'll come back. No, don't. You have to be constantly aware of that. I've seen parents telling me the children has finished a bottle of paracetamol. How did that baby have access to paracetamol and finish a whole bottle? Lack of supervision, leaving things where it should not be. We have to be constantly looking at our children from what I call child-proofing kind of perspective. All right, so we should decrease our stress. We don't call vitamin C sweet. It's never sweet. It's a drug. It can be overdosed on. Don't call iron supplements. It looks red. It look like real sweets and Smarties. Don't call them sweets. They are drugs, and we should treat them that way, and they should be locked away. And then accessibility is something we have to make sure that children don't have access to these poisons. All our household cleaning stuff, when you use them, you must have a cupboard where you can lock them away, or you keep them far away where the hands of these babies and children cannot reach. All right. Luckily, the pharmaceutical companies now are producing what they call child lock kind of covers on bottles and all that. In other words, children cannot open bottles because you need an adult to be able to override that. So the pharmaceutical companies are working on that. They are putting them in black bottles, something that children cannot easily see what is inside and all that. But it's not all the time. So we still really need to make sure that we keep our drugs locked away in cupboards or in fridge, and it's all locked, and the children do not have access to them. It is very important. And if you don't need it, don't keep it in your house. That is decreased availability. If you don't need something, once the drug has expired, please throw it away. Don't keep storing stuff, because when you have too many stuff, then it is likely for somebody to go and try to work on it, and then that can lead to accidental poisoning. So we have increased awareness through this ATP hour program. Please decrease the attractiveness, decrease the accessibility, and decrease the availability of these drugs to the children. So that is about accidental poisoning. But for most accidental poisoning, the most important thing for you to remember is you have to take the child to the hospital. Again, there's this or nothing you can do at home, but you have to get to the hospital within 1 hour. That is it. An emergency room where they know what they're doing. And if possible, let's make sure this doesn't even happen at all. Let's try to improve our home, decrease accessibility, decrease availability, decrease attractiveness to drugs. Let's not even ever play with drugs around children. Let's not be giving a drug to a child and then go open the door, which is what happened in a case scenario that somebody asked on our group. So just that split second of going to answer the door, the child has finished the whole bottle of paracetamol. So if the door is not an emergency, you can actually just finish with the drugs or take the drugs away, close it, and then go answer your door. We just have to think about these things, and then you will be able to do it. All right, final thing I want to talk about is the injuries. So when there are falls and injuries, how do we handle that at home? Again, this happens a lot. There's a time there was a season on ATP, we're getting loads of questions about children falling and falling and falling. And I see parents don't see it as a big deal. And oh, my child is always falling and all that. And I'm like, no, your child should not be falling, because falls can lead to head injury, they can lead to brain injury, and brain injury can lead to lifelong disability. It's as simple as that. So we really need to be thinking of these things and not make it too, like, we just trivialize it. The same thing with burns, and this is one of the reasons I don't advocate for hot water, steam inhalation and all that around babies. So many burns that we do get in even in newborn babies because of all this. So again, for like most accident avoidance, prevention, always better than cure. But we also should know what to do when our children has accident at home, because the home, to be honest, is a very dangerous environment for children. Most children are going to have accident in their own house or in the school, in the playground. That is where they're going to have it. And we really need to make sure we keep our children safe. So prevention, again, always better. So we want to avoid things like falls, we want to avoid things like burns, fire, accidents. We want to avoid children getting shot, especially once they start crawling, they start putting their hands in all your sockets and plugs and stuff. You need to child-proof your home. You need to cover those things up. Of course, I've talked about poisoning. We don't want children, and children, they go through the phase of putting everything in their mouths, everything they pick up, like the mom that wrote of her child eating the iPod, the hair piece, Children can eat anything, they can put anything in their mouth. So we have to be conscious of that. Also, children have drowned, and most of us have had instances that were even national news of these infants getting drowned, even in celebrities' homes. So we as parents, we have a lot of responsibility to do to make sure these things don't happen. And there are basic things we can do to avoid accidents happening in the home. We have to make sure our home is safe. But when it happens, we need to know what to do. So if an accident has happened, again, don't panic. Why do we keep saying don't panic? Because when you panic, you're going to do the wrong thing, you're going to even make more mistakes, and you're going to worsen things. So try and just be calm and assess the situation and deal with what it's like. What can I do? The child is bleeding, you can put pressure to stop the bleeding. If a child has had a bump on their head and there's some swelling, you can put ice pack, not hot water massage. You please just ice, cubes of ice, roll up into like face towel or handkerchief, and just apply it intermittently. So do that. And some cases you have to go to the hospital. If a child has been involved in a road traffic accident, a child has fallen from a height that is so tall, from a tree or something, some of those things are no brainer that we need to go to the hospital. It's not something you can deal with at home. All right. So falls and injuries are the most common ones. Children, when they start to walk, they tend to run as well. They fall, they tend to climb, and they don't have what we call awareness of danger. They don't know that this thing I'm doing, I can end up falling, so they tend to fall a lot. And in the process, they can break their bones and they can bleed and all that. So we want to make sure that we deal with that. So sometimes children just, they have what we call abrasion. They just kind of scrape, like I call it a scrape, and the part of the skin is lost. So what you can do in that case is just to get antiseptics and just clean it off, like use your cotton wool with antiseptics and just clean off any dirty surface and all that. You can apply some wound care like your GV, your iodine, and that's it. And most of those, or you can put your plaster depending on how big it is. And that's all the first thing you need to do. But you must have those things in your house to be able to do that. Sometimes children actually make a bigger cut into the skin that can be deeper, and these are the ones that may even need like going to the hospital for doctors to suture them to or to apply glue them together or something. Sometimes children can break the bones, what we call fractures, and this fracture can also happen in the head. So some parents just tell us that, oh, my child had a head injury, a fall, and the part of the skull is going inside, it's not coming out. That is actually a fracture. We call it depressed fracture of the skull, and sometimes it may require even a neurosurgical procedure to bring it up. So don't just say, oh, you can't see obvious broken bones. Sometimes it could just be that kind of fracture as well. And of course, there can be dislocation, at the joint, things can come out and all that. So these are all sort of injuries that can happen with bones and all that. I mean, with falls, and all that. The most important thing when it comes to injuries is ABC. Make sure the child's airway is not blocked, the child is breathing, the child is, is not in shock, is alert. So if the child is having airway blockage, or the child is not breathing or breathing very fast, or the child is collapsed, is in shock, that child has to go to the hospital. That's emergency, But if it's those minor stuff like we mentioned earlier, you can do that. If the child is the area is swelling, you can elevate it. You can rinse with clean water, and you can apply a sterile dressing or bandage over it. And most of us don't know what to do. If it is bleeding is severe, you may need to tie it, or put pressure on the area of the bleeding to stop the bleeding, because children can actually lose all the blood from maybe a fracture, or a very deep cut in their legs, and keep bleeding if the bleeding is not stopped. And of course, once you've done that, you have to go to the hospital. For fractures, you have to go to the hospital. Please don't take the children to bone setters, bone massagers, whatever they call themselves. I want them to egungun, like that's what they call it in Yoruba. You don't want to take your children to them, because whether you like it or not, the fractures will always heal. You don't need anybody to heal. The body will heal itself. The issue is when it heals, is it going to lead to what we call deformity, abnormalities? Because if you don't set the bone properly, then the healing will happen, but it will be awkward and the child may be deformed. So what the surgeons do basically is to make sure that the alignment and everything is okay, so that by the time the healing happens, it happens and things are back to what they were before the fall. So that is why it's so important to go to the hospital. And all these people, sometimes they end up introducing infections and all that. So please, and sometimes they cause the wrong thing to what we call myunion to happen. Then the child is going to go through double pain, because when we need to correct that, we're going to break that bone again and then fix it back. So you better to do the right thing from the beginning. So prevention again is number one. Make sure the children are always supervised. Don't let sleep children. Let's make sure that our house is safe. Let's remove as much clutters and stuff in the house. Let's use flooring that is not slippery. Those of you that use tiles, you need to wash that. You may want to go for things that are non-slippery, like wooden floor or even rugs and stuff, something that is soft and protective. And let's make sure that we keep, like, you may need to install what we call child gates around your steps area and things like that. We just need to think about it and we all know what to do. The same thing for burns. Let's avoid hot water around children. But if your child has suffered hot water burns, which is the commonest burns that happen, please don't take children to kitchen. Just pour cold water. That's the first thing you do. Pour cold water, no egg, no pap, just cold plain water. You can just to cool the area immediately, and then apply clean dry dressing, and then you need to take the child to the hospital. Depending on how severe the burns is, some minor burns, just minor treatment, but burns that involve the legs, the hands, the face, the perineum, the private parts and all that, those always have to be taken to the hospital. Burns that involve so much extensive surface area, you have to take to the hospital. A lot of parents pose questions about burns when they've not gone to the hospital. Please, it's important to go to the hospital because there are complications from burns, and that can really create problems. So to avoid burns, please don't take children to kitchen. Keep them away from kitchen. Don't let them have access to matches and stuff like that. When you're cooking, make sure you turn your pot handles in a safe way so that you don't end up causing spills. Children should not be holding onto your legs when you're cooking, because if there's any spills, pouring on them. And if you want to have your children to have hot water bath, and make all your mixes and all that done. Don't be carrying kettle up and down the whole place with the child with you. Leave the child in the room, do all your mix, do everything. Make sure you've returned the hot water bottle, kettle, everything back before you go for the child. That will help to avoid this scenario. Electric shocks is another thing that can happen, so please let's be careful. Sometimes you need to cover up all those. If you go to clinics, hospitals, you will see that we sometimes put something to cover open plugs or electric sockets so that children don't get putting their hands in it. And if it has happened, you need to take to the hospital. Let's make sure we don't allow our children to play with toys that have small bits, because they can shock on that. So you see some toys, they always say not for children under the age of 3 years. Not for children. The reason is because they have small parts that can come apart, and children will put everything in their mouth. That is normal for children to put things in their mouth. It's in developmental stage. What we need to do as parents is to make sure they don't have anything in their hands that they can swallow or that can cause choking or that can block their airway. So we really, really need to supervise the children. But if that has happened, you must know how to deal with choking. You can either do what we call back slaps, or you can do what we call Emlek maneuver. So the back slap is when for the infants, for the babies, let me see whether I have a picture. For older children, you can just ask them to cough and cough. Sometimes they can get things out for themselves that way. But for the older children, if they are unable to get it out that way, you can do this Emlek maneuver in this picture. Let me make it bigger. In which the child, you go around them, you put your hands. So you may have to watch videos online about how to do this, and then you kind of give them a thrust in their abdomen, and that may help them to get rid of whatever is blocking the air. But for the infants, we can do this back slap where you just put them on one of your hands and then you just hit their back like that, like this shown in this picture, and give them 5 blows like that, and whatever is in their airway will come out. If they put something in their ears, please don't try to take it out. You can't. You have to take them to the hospital. The ENT doctors have to do it in their own style. So let's keep little toys, objects away from children. Avoid nuts, fruits that have all these seeds and stuff in them. You have to avoid them. And of course, we always have to supervise our children. All right. For drowning, we have to take the child out of the water straight away. We have to warm up the child. Sometimes the child is not breathing. You have to do your CPR and they have to go to the hospital. But the most important thing is that let's not allow children around water without supervision. So there are lots of first aid treatment for all this. Is obviously I'm just trying to summarize them, but like I always advise us, there are lots of first aid training available for parents, available for everyone online, and they're free. So just look for free first aid training and you can learn some of these things, because sometimes we never know when accidents will happen. And I especially recommend for our nannies, those of us who have take care of children in daycares, our teachers, our schools, we all should be trained in first aid so we know what to do when these children have these injuries or accidents at home. So thank you so much for listening. So I've talked about 3 topics today. I've talked about conversion, I've talked about accidental poisoning, and I've talked about falls and injuries or accident that can happen at home. What do we do? And one of the things you will see coming out is that sometimes there's nothing you can do at home. Sometimes prevention is the best thing to do. We don't even want these things to happen at all. Or sometimes the best thing to do is to get the child as fast as possible to the hospital. For example, if a child is convulsing, once the convulsion stops, we go to the hospital. If the child has taken an accidental poison, within 1 hour, you need to get the child to the emergency room. We can still recover as much of the poison as possible. And for some other things, let's even not allow it to happen at all. That's the message here. But this is just like a taster for you to know what to do in case of all these common issues that can happen at home, like emergencies or accidents. But like I said, if you want to learn more, you can go online and study all this first aid training, how to do CPR, how to, very important skills for us as parents and caregivers of children to have. So thank you so much for listening. If you have any questions, like I said, you can head over to Ask the Pediatricians Facebook group and you can post your questions there and I will do my best to answer them as soon as possible. So I come your way again, same time, with a fresh broadcast, same platform. I want to say keep learning and keep keeping our children safe. Have a wonderful day. Bye. Bye-bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.